Hi everyone, my name is Kajal and I'm a physiotherapist from Core Concepts. Today we'll be talking about the three most common nerve injuries that we see in the clinic. So the first most common injury is called carpal tunnel syndrome. And this is when the medial nerve that travels down to the hand gets compressed by the muscles and the other tissues surrounding it. The median nerve, like all other nerves, stem from the spinal cord. The median nerve specifically travels through the neck, down the arm, all the way down to the wrist and our fingers. The carpal tunnel is specifically where the wrist is, and the median nerve travels through that and spreads around through our fingers, just like how a tree trunk branches out into different branches. So the portion of the median nerve that travels through the carpal tunnel controls the muscle functions in your hand as well as the sensations that you feel in the front and the back of your hand. Generally, when the area gets swollen, it compresses on the nerve, and this can result in weaknesses throughout the hand as well as changes in sensation. Some people generally find that they have difficulty gripping onto items such as their mugs and their bottles, and that's usually when it concerns them the most. The second most common nerve injury that we tend to see in the clinic is known as sciatica. Sciatica generally involves the sciatic nerve, and just like the median nerve, it starts at the spinal cord, but this time it travels down the back of our legs all the way down to our foot. When someone experiences sciatica, they usually complain of radiating pain going down the leg, sometimes even stabbing or shooting pain. Sciatica can affect either one or both of a person's leg, and the intensity of the pain that someone feels generally varies between every individual. Some people complain of radiating pain going down their leg, but others complain of really sharp and shooting pain going down their leg, experiencing numbness and weakness in between. The third most common types of patients that we see coming into the clinic with nerve injuries are stroke patients. A stroke generally affects the brain, and this in turn affects the transmissions going through the nerves down to the rest of the body. The nerves can either be sending too much signals or too little signals to muscles or to sensations as well, and this can lead to imbalances throughout the body. Depending on which side of the brain was affected by the stroke, it will influence which side of the body is affected more than the other. And the most influenced body part also depends on where the stroke occurred in the brain. Some of the most common post-stroke symptoms involve the inability to initiate or control movement, the changes in sensations in certain areas of the body, changes in gait, and changes in muscle tone and or strength. In the next video, we'll be talking about how physiotherapy can help with these three nerve conditions. Okay, thanks for sticking around, guys. If you enjoyed this video, please like and comment if you have any questions down below. I'll see you next time.